Birthing Better families who developed these skills were pragmatic people. Many of them were highly religious, and the majority of them were medically high risk. I have no medical training, and I'm not a religious person. So we found what was common for all of us, which was our pregnant birthing body. All of these skills are important, and they're all effective. However, we do not all use all of the skills. Not all of us need to use a hip lift to create space for a baby if our baby comes easily through our body. Breathing, most of us used because that made sense. Breathe in and out all the time. The touch, some of us used. The nonverbal and verbal communication, most of us used it. The body skills, we all liked learning, but we didn't always need to use a sit bone spread either. However, if we were going to labor and have a vaginal birth, the internal work was absolutely vitally important. Now, the internal work developed from an obstetrician who became a midwife and talked about it. He never showed it, he just talked about it, how important it was for women to prepare inside their birth canal. I knew this person in the early 1970s, and nobody was talking about preparing down there at all. And then by the mid-80s, people were talking about perineal massage, which was massaging the tissue between the vagina and the rectum. Honestly, that doesn't work. That's like massaging a tiny bit of your earlobe when you have a headache over your whole head. You actually need to massage and work with all of the soft tissue in the whole inside of your vagina. A lot of women will go, oh, yuck, or I'm not going to do it. Get over it, honestly. You've got this coming through you. You do not want that delayed. You do not want to be damaged. You don't want to tear, and you do not want to be cut. You want to spend 5 minutes a day from 32 weeks onward, and you can do that. The audio in this is, first part of it is to help your partner do it on you. Over 80% of men will help their partner with the internal work. It helps men shift from seeing you as a sexual object to seeing you as the mother of his child and making certain that he can protect you and his child not having damage or trauma. It's really important. The very ultra-Orthodox Jewish community and the very conservative Muslim community do this as their homework. They feel it is really, 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 really important. And you will know immediately whether you've done enough. Any is better than nothing. And the places that are tightest inside you are the places you need to work on the most, because this big object will get hung up on tight areas in you, just as this big object, if it's relatively big for your bony structure, needs you to create space in that bony structure and soften in that soft tissue. And the soft tissue of the birth canal can easily be felt from going inside. So you have a big tube and a big space. You'll learn all about it, and you'll also work with that outlet as well. Please do it. You won't regret. Shorten second stage HEAP, and after the birth, you recover really, really quickly. The chances of you developing hemorrhoids or having pain on sex for the rest of your life or having terrible problems with incontinency, those things just disappear because you took 5 minutes a day from 32 weeks onward to stretch the internal tissue in your body and soften it so that this object can come down easily. Do it. It's important.